Hello, I'm Tom Styx with Empire Surgical. In this video I'm going to discuss some of the basic steps of an ACL repair using the Mytech Rigidfix for a BTB Autograft. So when I say BTB, we mean bone, tendon, bone. That's the type of graft we'll be using. Autograft meaning it comes from the patient. So the first step is you'll have to harvest, the doctor will have to harvest the graft from the patient. In this case we use a patella tendon. It's going to have two bone blocks on either end coming from the patella bone as well as a bit from the tibia. So the doctor will remove that, put it on the table, drill a couple holes in either bone block. That way he can pass some sutures through there. The sutures will then be used when we're pulling the graft into place, also to create some tension before fixation. So the first step beyond that with any ACL repair is drilling the tibia. With the Mytech tray we have the tibial guide. It's either single pronged or double pronged. You're going to set those prongs on the tibial plateau about 7 millimeters anterior and 7 millimeters medial of the PCL. Once that's set, you set the angle for the guide, set it about 55 degrees. That's pretty standard measurement. Once you're in place, you use the bullet to tighten it up, make sure, and you can rotate that to lock it into place, and then the guide will be set. At this point you're going to open the ACL disposable kit, which will have two beath pins. For the tibia, you want to drill using the shorter beath pin. So take the shorter beath pin and drill through the tibial guide until it breaches the tibial plateau. At this point you then remove the guide, leaving just the beath pin extending through the tibia. So now we need to get our reamer. The reamer is really going to drill out the hole and create the tunnel. So depending on the size of the graft that was initially harvested, that's going to dictate the size of the reamer we use. For the tibia side, you want to use a fully fluted reamer. So taking the fully fluted reamer of the appropriate size, it's cannulated. You're going to insert that directly over the beath pin, and you're going to drill until you breach the tibial plateau. At this point you can remove the reamer, remove the beath pin. Now we're going to move on to the femoral tunnel. So drilling the femoral tunnel, first step is to decide how deep of a back wall do we want to have. That's completely up to the surgeon. Once you determine what you want to do, there's a simple formula that you're going to use to determine which femoral aimer to use. So depending on graft size, take the size of the graft or tunnel that you're going to drill, divide that by 2, and then add the depth of the back wall. Once you determine, you use the appropriately sized aimer, insert that through the tibial tunnel, hook it to the back of the back wall of the femur. At this point you take the disposable kit, take that long beath pin, attach it to the drill through the cannulated aimer, and you're going to go directly through transtibially and up and out laterally through the femur. You can then remove the aimer, and you're going to be left with the long beath pin extending through the tibial tunnel and then up and out the lateral cortex of the femur. Now it's time for a reamer again. Again, we're going to take the appropriately sized reamer. This time we use the acorn reamer. Acorn reamer is cannulated. It's going to go over the beath pin. You're going to drill up to the laser line that corresponds to the appropriate depth for the tunnel. Now you want to make sure when you're drilling the tunnel depth that you go with the length of the bone block from the graft. You want to make sure that you drill at least that deep. So when you pull the graft into place, there's none of the bone block that left hanging into the joint space. So once you get your reamer, you drill it to that laser line, remove the reamer, leaving the guide pin in place. Now it's time for the Rigidfix. You assemble the Rigidfix using the appropriate size rod that corresponds to the tunnel again. So for instance, if we're doing a 10 millimeter tunnel, take the 10 millimeter rod, attach it to the Rigidfix guide. We're going to slide that over the beath pin, up through the tibial tunnel, into place into the femoral tunnel. You might need a mallet to mallet that in, and you're going to mallet it to the appropriate depth. Again, there's going to be laser lines that are going to indicate which depth you're at. Typically about 30 millimeters is pretty standard. At this point, we go to the Rigidfix disposable kit. You're going to have some sleeves, 2 sleeves with the sleeve trocar. And take that trocar over the sleeves. You can drill them using the arm guide and insert them from the lateral side into till they make contact with the tunnel that's been drilled. This will be, you'll know you're in the tunnel when you turn on the pump and there's water flowing out of those sleeves. Once you're at this point, those sleeves are fixed. You can remove the Rigidfix guide, and it's time to pull our graft into place. So at the bottom of the beath pin, there's going to be an eyelet, and you take the sutures that you passed through the graft, tie them to the eyelet, and then you can pull the beath pin, pull it up and out, pulling the graft into place. Once the graft is into place, you use those sleeves and a step trocar, and you're going to drill till that bottoms out, and that's going to create a hole through the bone block for which our pins for fixation can be inserted. So you do the superior one first, then the inferior one. Directly after you drill through the bone block, you want to take those cross pins, which are also in the Rigidfix kit, and take a push pin, insert them in the sleeve, and push those pins so they cross the graft, one on top of the other. That's going to be your fixation. In order to verify that, the doctor can pull on the tibial side, and the sutures that are attached to the other bone block on the tibial side, make sure it's tight, extend and flex the knee a little bit, make sure that the cross pins are fixated properly. At this point, you can remove those sleeves. The last step is to just fix the tibial side. So typically you're going to use a screw. We can use a Milagro screw. Insert the guide wire, insert the inserter over that guide wire, using a Milagro screw for instance. You can screw that in and then remove the inserter by pulling straight out. All there's left to do is sort of trim the excess tendon that's left behind or bone block, and make sure that there's nothing hanging out on the tibial side. So that's a little bit of the basic steps: drilling your tunnels, and inserting your guide wires and drilling with your reamers. I hope you've enjoyed my presentation. I'm Styx.